Did you know that orthodontics can actually cause problems at the end of the road when you're done getting your teeth straightened? This is a little known fact, but it's something that I actually see almost daily in practice. So let's dig into this. What things can be caused by orthodontics? What things can be helped through orthodontic care? And how do we do it differently in a health-based dental practice? So first of all, a lot of you understand that the reason for orthodontic care is to straighten teeth, and they do a great job. All of our smiles look amazing. Unfortunately, there's a couple of things that aren't always considered in traditional orthodontic care that I then see the problems with down the road. So let's talk about a few of those. The first is if the mouth is very small, a lot of times orthodontists will do an expander, which will make more space for the teeth. But they do also do a few things that actually make the mouth smaller again. Let's talk about them. One is hopefully a practice that's gone largely away in orthodontics, but that's taking teeth out to make more space for the teeth in the mouth. Let's just talk about why this could be problematic. So let's say you have a child and they have really jumbled up crooked teeth. And the orthodontist looks and says, okay, I can straighten these. It's going to take a lot of work. We're going to need to expand the mouth. And what that's doing is it's literally making more space for all of those teeth to fit in. It's making more real estate for them to all live inside of. That's the harder way, is to actually expand out the mouth and make more space for everything. And sometimes they say it's not even possible. The mouth isn't going to be able to expand enough to fit all the teeth in. So they recommend removing teeth. It's also an easier way to do it, to remove teeth, because if you remove teeth, it's all of a sudden much easier to get everything straight in the space that's there. But why is that problematic? Well, we talk a lot here at Total Care Dental about airway and about space to breathe. Here's the problem. If your child already has jumbled teeth and crowded, crooked teeth in a mouth, that means their mouth is very small. And that means there's not enough room in that mouth for all of the tissue and things that need to fit. So behind the teeth is where your tongue lives. It's where the soft palate lives, the uvula. All of those tissues have to live behind the teeth, but in front of the tube that we breathe through. So there's a real specified space behind the teeth, in front of the tube you breathe through. And that space has to be large enough to allow room for tongue function, for tissue, for all of these things. Now, I see adults that are at the end of, I had teeth taken out for braces. And what I can tell you is they did not consider this space for the tongue to function and for the tissue. So now the mouth is smaller. They took the teeth out to make space for all the teeth, but that left the mouth too small for the tissue, for the tongue, for the uvula, for the soft palate. So all of that has to crowd back into the tube that they breathe through. What does this lead to? It leads to sleeping issues, to sleep apnea, but also just sleep obstruction, which will show up as fatigue during the day. You're waking up, but you still feel tired. You toss and turn at night. You have a hard time going to sleep, or you can't stay asleep, or you snore. All of these are signs that that tissue is too far back and blocking the tube that you should breathe through. And it comes from there not being enough space in the front. So in orthodontics, our goal here at Total Care Dental is to make more space for the tongue, for the tissues. Now, I joke that I see patients all the time with this issue, and I call it the ambient generation. Now, this actually isn't a very funny joke because I see so many people that are on sleeping medications, or they're doing every single thing they can think of to try to sleep better. They're on cpap machines, which are miserable. A cpap machine is basically this pressurized oxygen mask strapped to your face. It makes noise. You can't sleep without it. So I'll often joke with patients, I'll say, you got to choose your spouse that you're sleeping at night with, but did you choose the cpap that would also be in bed with you every night? Probably not. And when I ask them, would you still choose it? They all say, no, I don't want to sleep with a CPAP, but I can't sleep without it. Why? Because that tube is being pushed on. It's being crowded out by all the tissues. So I see so many adults that had teeth taken out for braces. They're coming to me because they're not well. They have no idea that this braces piece had anything to do with it. So we talk about it and we say, okay, thankfully we can actually make more space again, but it's kind of doing reverse orthodontics. We're going to expand those teeth out and make more space for your tongue and tissue to function, but it's going to create spaces between the teeth again. So all the things that orthodontics tried to correct, we're going to undo, which is a little counterintuitive, obviously. And I'd rather not undo things. I'd rather do them right the first time around. So what does doing them right the first time around mean? Well, that's the first problem. We don't take teeth out for straightening. We make more space in the mouth for straightening. The other thing that's commonly done in orthodontics is it's called interproximal reduction, or IPR is what it's abbreviated as. What they're doing is they're actually shaving off just little bits, but shaving off the sides of teeth. Now, it's done for two reasons. One is to make more space in the mouth, but number two, sometimes the tooth doesn't look quite right. There's little what we call black triangles between the teeth down at the gum line. And again, you're bringing your child to the orthodontist to have a drop-dead smile when we're done. You're not probably going to be thrilled with those little black triangles. So they will reduce the sides of the teeth slightly to make them fit together more flush and, smoother. Unfortunately, that all reduces the space in the mouth for the tongue and the tissue. So this all goes back to that. So that's number one issue that can be created in orthodontics. We're going to get to the fix here in a moment. Another issue that can be created in orthodontics is retention. So a lot of people come and they'll say, I've already had orthodontics 3 times. And I just stopped wearing my retainer. I mean, how many times probably have you heard this too? I just stopped wearing my retainer and my teeth started to get all crooked. Or my wisdom teeth started coming in and my teeth started to get all crooked. Well, I'm going to really challenge this thought right here. If we have to hold something in a position, it means it's not in a natural spot. A really great example is a retaining wall. Why do they put a retaining wall in? Because they're pushing dirt and soil and rocks up to a spot that they weren't naturally in. So we have to put the retaining wall there to hold it there. That means it's not in a stable spot. That retaining wall comes down, the dirt and the rocks are going to come down as well. Same thing happens in the mouth. If the teeth are put in an unstable position, they require a retainer to hold them there long term. And if you stop wearing the retainer, the teeth are going to move to a more natural position. What is that natural position? The teeth have to fit between the muscles on the outside, which is the lips and the cheeks, and the muscles on the inside, which is the tongue. They have to fit between those two things. And let's say, for example, you can't actually breathe very well because your tongue's getting pushed too far back. What's going to happen is when you swallow, when you lay down at night, when you're trying to get more air and all those tissues are getting too far back in your throat, the tongue is going to push up and forward. Well, what is that going to do against the teeth? The tongue is actually a really strong muscle. That's going to move the teeth. So you're going to have tooth movement because you don't have enough room to breathe. So the teeth are in an unstable position. So the goal is to put the teeth in a spot that all the muscles are at peace, that the lips and cheeks are there where they belong there, that the tongue has enough room to function. And when you put it in that spot, the teeth don't move. This is a very interesting concept. The other issue with orthodontics is oftentimes, especially in children and teenagers, they don't clean their teeth very well. And sometimes we see a lot of tooth decay at the end of orthodontics because it's so hard to clean around all of that hardware. So now you have cavities that are filled, and those fillings are done at age, 14. That means that filling is going to be redone numerous times over a lifespan and probably turn into something bigger and bigger and bigger each time it's redone. So by the time you're late into adult years, you may have crowns or veneers or root canals or extractions and implants and things because of those early cavities. So if there's a way to prevent all 3 of these problems, crowding out space to breathe, a need for retention, and cavities, we're all about it. So let's talk through what we do here at Total Care Dental. The first thing we look at is say, do you have enough room for all the tissue? Do you have enough room for the tongue to work? Is the tongue actually tied down to the floor of the mouth? Is that part of the issue as well? And we look at those tissues along with the teeth. So the teeth aren't the only component here. We look at the tissues. We look at the airway. We say, how much room is actually in your mouth? Is there enough room for the tongue to fit? If not, we start there. So when you do orthodontics here, sometimes it gets worse before it gets better because we're going to spread all the teeth out and we're going to make space. But remember, space isn't the enemy. Space might be the enemy to cosmetics, but it's not the enemy to breathing. So we make space and we make sure that you're going to be able to breathe and function well first. We make sure that the tongue can go where it's supposed to go and not back. We make sure that the lips and the cheeks are all where they belong with the tooth position. We get that first. Then we work on the cosmetics, where we move the spaces back as far as we can out of the smile line. But there may still be spaces. And sometimes orthodontists look at what we do here and they say, well, that doesn't look like mine looks at the end. That doesn't look perfect. We say, but what's more important? To not be able to breathe and be on a CPAP at age 40 and to have high blood pressure and all sorts of other heart conditions and chronic fatigue and autoimmune conditions because your body's always in fight or flight. Is that better? Or maybe some spaces way back here around your molars where we can't even see them. So there's a little bit of a give and take, but we want to make enough space for that. What do we see in children that have things crowded in and not enough space allowed? We see ADHD symptoms. We see bedwetting. We see just focus problems in general, waking up with what we call these dark allergic shiners under their eyes, kind of these dark bags under their eyes as a child or as a teenager. Those are all signs they're not getting enough air. So that's step number one, is let's make enough space. So we do this with expansion, and we have a few ways we can do this, and we can do this in children, teens, and adults. So we have ways to expand, and a large majority of our expansion methods are removable. Why is this an advantage? Because then you can clean the teeth. So they look like clear aligners. The brand that we use is called Candid. So they're clear. You don't see them at all. You can take them out. In fact, you should take them out to eat, and you take them out to clean. So we don't have the issue of the tooth decay that you have around traditional braces. So expansion happens first. Then we put the spaces where they belong. We make sure that the tongue is functioning like it should. And oftentimes we have to actually retrain the tongue and reteach the tongue how to function inside a bigger space. So we do something called myofunctional therapy. And that goes along with a lot of our orthodontic cases here. Another thing that we do is sometimes that tissue in the back of the throat is so stretched out and just saggy because it's been stuck in the airway for so long. So we also have a laser procedure called night lays that can shrink that up and out of the way while we're making more space in front. All of these things go hand in hand with orthodontics. So the other thing we haven't addressed is that retention piece. If we do all of these things right, if we retrain the tongue, we make more space for it. We retrain the lips. We call it the lip seal. So many people nowadays are doing lip taping or mouth taping at night while they're sleeping. Why? Because their lips don't know how to stay closed over their teeth. So we create a situation where the lips naturally close. Sometimes we still recommend mouth taping because it helps, but we want all the muscles to be relaxed where the teeth are. And if that's the case, the teeth stay there without retention. We still use those clear aligners sometimes at night just to make sure. But again, if the muscles are stable, the teeth stay where they are. So this is a whole new paradigm with orthodontics. And I personally see so many patients who've been challenged because of orthodontics. Not necessarily anybody doing anything wrong, but just standard care left them not being able to breathe. And really, honestly, an airway cripple in their 40s and 50s and later in life. We want to completely prevent all of that in children, first of all. So the first thing we do when we look at a child is, how can we expand? Do we need to expand? Do we need to make more space? Do we need to utilize their growth and development years to grow the mouth big enough for the teeth to fit? That's the first thing we're going to do with orthodontics here, is make enough space for all the teeth, no matter the age of the patient that we're talking about. Make enough space for all the teeth. So we want to prevent these issues in children, and we can correct these issues in adults. That's what health-based orthodontics looks like. It's a little different. And honestly, I get pushback from orthodontists about this because they don't see patients later. We see you later. They see you now. Your teeth are straight, your smile looks awesome, and you're high-fiving and paying them. And it's great. But I see you 20 years from now, when all of these sleeping issues and health problems have surfaced because of this situation. That's what we're here to prevent or correct, either way. If this is something that you're interested in, give us a call. We love to help everybody have a perfect, wonderful, gorgeous smile, but also one that functions.